exciting that we are now in our third year of the ORL Emergencies Boot Camp. We first started at the Washington Hospital Center, our first try, which was, we thought, very successful, but over the last 3 years have really fine-tuned the program as well as the curriculum. We continue to draw faculty and participants from the Mid-Atlantic region as well as across the country. Our curriculum specifically, we still have the concept of teaching specific skills throughout the morning and then building on those skills in the afternoon, where we have complex scenarios and the participants take those skills, bring them together, and manage a complex patient case.
Starting July 1st, they're expected to have a certain level of expertise, which we know takes years to develop, but this helps them accelerate the process of developing those skills.
The nice thing about it is it's a very controlled setting, so in those scenarios you're allowed to, mess up and have a poor consequence that I can avoid in the future. So doing a boot camp like this gives us an environment to ask questions that you can't necessarily ask in an emergency situation.
This was something to bridge the gap from book learning to hands-on patient care. And simulation can mean a lot of different things. It can be very complicated, very expensive. And Sonia Melixide has really been very instrumental in pioneering low-tech ways to teach skills that we can transfer from book to clinic.
Reading about something is a very important way to build basic knowledge. But until you actually have your hands on and do it in a real time-sensitive manner, you don't really grasp the wealth of information that is needed. This is basic, everybody needs to know type of information and skill and knowledge. And I don't know any other way to relate that information and for the learner to actually assume that knowledge and those skills without practicing.
It's something that we don't necessarily get exposed to a lot when we're on call. It's something that you might do once or twice your entire residency, so you can't count on having seen something like that before you actually have to do it. So it's not something that you can necessarily practice on patients either, because there's only going to be those one or two that ever need it. So it's something that you're going to be by yourself some night. It's going to be year 4 of your residency and somebody's going to need one, and you're going to be the only person in the room that's expected to know how to do it.
For the entire day I had a lot of fun. I learned a lot and met some interesting people, and I feel more confident coming out of it.
It's an opportunity for our new residents to learn some of the basic skills that every ENT resident needs to know, and for that matter, every ENT doctor.